Or it was kind of like, yeah, that was not.
So he was self-aware.
And it's that self-awareness, because when he came in, he really was like, no, stop trying. You're part of the FBI. You're trying to shut me up. I will not be shut up. You know, the world needs to hear this. Obama needs to hear me. And completely different. Exactly. It's difference in self-awareness. Yeah.
I was just wondering, to what extent are people aware that they're delusions, and especially like maybe with the later onset, where they know they used to be normal and fine, and
that's a really good question. And there's some argument as to if, well, I don't think there's an argument. If you're seeing things, regardless of whether or not you know they're real, it's hallucination. With the schizophrenics I work with, they know. I mean, they know that this one guy's like, there are 30 people yelling at me about what a horrible person I am, and they're even talking to each other. You ask me, it's like, yeah, there's like 4 women, it's mostly guys. They're all, and it's really distressing. So knowing they're not real is still, it doesn't help. You know what I mean? So
yeah, they don't have control over it, but
Exactly. So, I mean, I think, different people would argue different things. Actually, a good example is, and I don't want to keep you guys over, but I see Margie looking at her watch. A good example is someone who, if you ask them, well, you know what, I'll get to those examples because that's part of the differential diagnosis. I'm sorry. If I over-answer anyone's questions, you can say you answered my question. Okay, delirium versus psychosis. Here we go. Delirium appear psychotic, but they're not always, that's not a psychotic disorder. The DSM makes very clear it's a separate diagnosis. Okay, delirium may have symptoms of visual hallucinations, seeing things. You can be delirious because you have pneumonia and you're not getting enough oxygen. If you're hypoxic, which means you don't get enough oxygen, you see things. Very common. To have someone post-pneumonia or in the middle of a pneumonia illness, seeing things. The key difference here is that the delirium involves a diminished state of consciousness. Okay, so you're delirious. I mean, I think we all, not to define the word with the word, but you kind of know what delirious means. You're out of it. You're not kind of in and out of consciousness. You're less aware of your surroundings. You may be disoriented. It's very different from psychotic. And the real reason here is that because it's often caused by the side effects of medication. So you have older adults that are on 20 different medications. They go to 4 different doctors. They're all prescribing different things. They don't know what each other are prescribing. Pretty common. Or you have an infection. A lot of times pneumonia or urinary tract infection, actually. Like, we won't even test anyone anymore unless they've been cleared of having a UTI. Because this fluctuation in state of consciousness is you could be testing someone and they just all of a sudden are out of it and they look like they're completely amnestic, but in reality, they're delirious. They don't know what's going on. Anyway, UTIs is just, for some reason, like, they just are so common in where I work. Okay, substance-induced psychosis, like this guy that really thought Obama needed to hear from him. He was basically had been switched to a different substance, and actually he was going a little bit over on his dosage too. He has a chronic pain disorder from a car accident. So again, you have this multiple medication interactions. We also have withdrawal-related psychotic symptoms. There's a woman who came in with delirium tremens. She was really hearing things, talking, thinking her family members were talking to her, and they weren't even in the house. And this was basically because after she had retired, this is another stressor that can be really stressful for people to retire, believe it or not. To do. This was a woman who worked probably 80 hours a week, retired, and just didn't know what to do, so she downed 2 bottles of wine a day. It's a lot of alcohol. So, yeah. Mostly see prescription drugs and alcohol being abused currently. That's projected to change. It's projected to increase in incidence, both in incidence and in range of abused substances. So you're actually starting to see crack withdrawal in older people, and cocaine, and they think this is due to the aging baby boomers. I don't know. I'm playing it all on aging baby boomers. That's what it seems to do, at least. Okay, quickly, related to medical disorders, this is such a underrepresentation of all the things that could cause psychosis, but we got cardiopulmonary, vitamin B12 deficiency. That is actually the reason behind things like Korsakoff psychosis, which is commonly seen in alcoholics, but not because they're alcoholic, but because they don't have enough vitamin B12. You'll also see this in people who don't eat enough, and just, I mean, it really makes, vitamin B12 is important, put it that way. And infection, we already gone over this. There's one interesting thing, there's expected to see a rise in HIV-related psychoses. Recently assessed someone for HIV-related dementia because we've got drugs that are so effective now. People can live for a very, very long time with HIV infection. And so now we're seeing that the result of the aging brain, or as a result of the aging brain, this infection starts to have interactions with that. And you can see some evidence of psychosis for dementia. And that's, expected to survive, which, or to increase because of the survival rate. So that's an important thing to address. Yeah. Well, Margie's going to talk about major depressive disorder, I think. This is older adults with major depressive disorder. I want to be very clear that that might be a high estimation, but you see a lot of that. People who are in for depression, but it's really because of the psychotic features of the depression. So what's the psychotic feature of depression? You got themes of persecution, guilt, nihilism, like my organs are rotting. And it's not just a euphemism, and they're not just, or not euphemism, opposite of a euphemism. It's not just they're not just being metaphorical there. They're like, I am rotting, I'm decaying. There's also a lot of there's no reason for me to live, I'm useless, and just really, this person is at a high risk for suicide because of these psychotic delusions, and they really are psychotic delusions. These people usually do actually have, well, not always, but some of these people really do have family members that really care about them. They're the people who brought them in the first place. Related to a manic episode of bipolar disorder. Now, in older adults, it's really important, of course, so someone comes in, they're psychotic. Usually we can tell if it's a manic psychosis because a person's euphoric and just feeling great. We had one person that was, actually we'll get to that. But in older adults, though, it is usually problems with treatment medications. Actually, we're getting to it now. So suddenly the metabolism, oh dear Lord, what just happened? Okay, well I can still,
No, it should come.
will it come back on? Is it just?
In here. She's in here.
That's not good.
It's not our computer.
Oh, it's fine with me.